director of the National Institutes of Health, Jay Bhattacharya. Okay? Doc, it's good to have you.
Good to be here. Thanks.
So first, what is your take on the president's take that, hey, the companies tell me that Operation Warp Speed was the biggest difference maker positively in the pandemic, and I want everybody to understand the data the way they do. What do you think of that?
I think it's really healthy to have transparency about what the drug companies that were involved in Operation Warp Speed know. It's also really healthy to open up a discussion, an honest scientific discussion, uncensored, on the evidence on the COVID vaccine. I think I was just listening to your last guest talk. I mean, he's absolutely right. A lot of people have lost trust in all vaccines as a consequence of essentially misstatements. I don't know what you want to call them, including things like, the vaccine stops you from getting and spreading COVID. Remember all the mandates, Chris, that were in place. I mean, I think that kind of level of distrust I've never in my long career in public health have seen before. And what the president's doing is very, very healthy. Transparency is the way forward.
But you know so much already, Mr. Director, that would show that, one, not just the low fruit, like there's no nanotechnology in the vaccine that tracks you, or any of the things that have killed more people than it may have helped. There's no data basis for this. This is propaganda. Do you agree or disagree with the president's main assertion, which is the companies tell me that the vaccine helped and made a positive difference in this country, and I want people to know that? Is he wrong?
Well, what he's saying is, let's open up and look at the data. I mean, I think if you look, for instance, at older people, it probably, I mean, I'm almost pretty convinced that it did make a positive difference. If you look at young men who got myocarditis at high rates, but weren't really dying of COVID at very high rates, it's less clear. Pregnant women. There's a lot of data that the public hasn't really seen, and it's worth looking at. It's going to be a nuanced answer, Chris. I think Operation Warp Speed was absolutely the right thing to do in 2020. If you're in the middle of a new novel virus spreading around, and you have the capacity to deploy the amazing scientists to try to address that at a rapid pace, it was definitely the right call to make in 2020. When the data started coming in 2021 and the mandates started going out, well, that's when we started getting into a lot of trouble. Having an understanding of what was known at what points in time,
yes.
And also making sure that people who were injured get an honest, an honest take, rather than like censor the kind of the way they were in the Biden administration. I think it's, again, Chris, I mean, for me, the most important thing is we need to have public health be honest with the American public. That's to me, that's the upshot of the president's take,
Listen,
which I really just admire.
Listen, I'm here for it. You're always welcome here, Jay. I believe conversation is the cure. I got two more other boxes I want to check, and then I'll let you go. But you're always welcome here, and I appreciate it, Mr. NIH Director. The first one is, what I don't like is pendular overreactions in politics. mRNA has become a dirty word. You know it isn't. You know it is the key to a lot of medical research going forward. And it seems to me that cutting the funding is about politics, not about public health policy, because what are the chances that any of the things we need to stave off in the future will have nothing to do with mRNA, which now may not be researched the same way because of the moves that are being made?
Well, at the NIH, we're still researching mRNA. So, for instance, for cancer, it's potentially quite a useful tool. I mean, there's a lot of research in promising places to look. So we're not cutting research off. What Secretary Kennedy recently did is he cut off production contracts for mRNA vaccines that, for COVID that people just aren't using, Chris. I mean, why should the American people, be spending
so much money? But isn't there a research component also to the funding cuts?
I mean, it was mostly with BARDA contracts. The NIH, we've not cut off research contract or research on the mRNA. We're still, as I said, working on our mRNA for other technologies and other potential uses. And of course, mRNA. This is not just for the vaccines, but the mRNA itself is is a really important area of research. There's nothing that's going to change us from looking into promising areas of science, including that. But for public health, we have to restore public trust, and putting money into vaccine platforms that the public largely doesn't trust. I don't see really the logic in that.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.